Welcome back to another episode of the AMP podcast. Today, I am joined by my colleague and friend, Dr. Lupowitz, who is a doctor of physical therapy. He's a board-certified sports clinical specialist. I had to write this one down. And he's also a strength and conditioning specialist, like myself. He's the owner of Longevity Physical Therapy and Performance. They're located in Garden City right now. And Lewis specializes in helping people get out of pain, rebuild strength, and return to sport, fitness, and life. I am actually a client of his as well. He's helped me work through many injuries, former football injuries, lifting injuries, or just like life injuries, my knees, my shoulders, just about everything, help piece it back together. And I always call on Lewis, whenever we have a client that's dealing with any type of pain, any type of former injury, maybe coming off of surgery of some sort. And we have really worked very well together for the last couple of years, collaborating on different clients that are, obviously coming out of physical therapy, or maybe, a client that we're working with that may have gotten injured, an athlete, or an adult. Today, we're really, the main objective today is to kind of give a little bit of insight on the process and collaboration of how physical therapists and strength and conditioning coaches, as well as personal trainers, can work together to keep people moving, keep people exercising, keep people on the field, and keep people, feeling good. Even though every day they wake up, they might have some aches and pains. They know that, the main thing about that is getting out of that pain that causes more issues down the line, and we can talk about that today. So, Dr. Lupowitz, thank you for coming down today.
TJ, can't thank you enough for having me, and can't speak highly enough to all the collaboration and great outcomes that we've had over the years together. Absolutely.
This is something that we talk, as a customer of Dr. Lewis, I've been, we go back and forth, talking about obviously aspects of the business, but also just the industries that we're both in. I went to school for sports medicine at Marist College. Dr. Lupowitz, you went to school for physical therapy, obviously, and Binghamton, correct, undergrad? Yep. And, there's a reason why we went to school for those disciplines. My original goal was to become a physical therapist, but I decided that, I really wanted to be on the performance side of things and, help people stay away from the doctor. But Dr. Lewis has a very, similar idea of, what performance physical therapy really looks like. And there's a difference between, what everybody sees in physical therapy, or what they think of when they hear physical therapy, and what a true performance physical therapist is. And I think that is, what Dr. Lewis, for me, is somebody that I always recommend, and always talk about the amount of professionals that I've worked with over the last, 15 to 20 years of being an athlete, a coach myself. There is no one that I put in a higher regard than Dr. Lewis when we're talking about, just the passion for the field, but for just helping everyday people, and also working with high-level athletes that we've both been able to work with as well. So tell us a little bit about kind of like what got you into physical therapy in the first place, and, what brings you here today.
Well, first and foremost, I can't thank you enough for that warm introduction, and I can't speak highly enough to what you've done in the industry, and how you've helped grow my practice, my profession, and keep me, inspired to continue to work.
Absolutely.
Moving forward. But yeah, I think, funny enough, I think it was, maybe ingrained in me, and maybe just some destiny to some regard. Growing up, my mom is a personal trainer, group fitness instructor, and, way before I was even born, my dad was in a, pretty near traumatic car accident, which actually left him learning how to re-walk, re-talk, and he still has some aches and pains today. This was obviously prior to getting into PT school, and during my undergrad at Binghamton, I was actually on path to go to dental school. Why? I didn't really have a good answer. Mm-hmm. And, I was living in a house with a bunch of friends, and I was kind of the only one that was in like this pre-med, pre-health track. And you could imagine the amount of like injuries coming my way, just like, hey, I think I rolled my ankle, or hey, I did this. And I was just like, never knew the answer as to like how to help people get back to sport and life and do. And growing up as an athlete myself, it was just something that I've always had a passion in. It's just like keeping people staying active. And, it wasn't until one day that a buddy came to me with a finger that must have been sideways, and I used dental floss to buddy it up. And I was like, dude, go to the ER.
Yep.
And I was like, I don't think dental school is for me. And a friend of mine was like, why don't you look into physical therapy? I've done it. It's cool. It seems like sports. And looked into it, started working in a clinic, and really never turned back. And was kind of always set in this sports-oriented, pre-health, health, active kind of mindset. And the two just sort of bled together from early life before I even knew that was what I was set out to do into, where I ended up to today. And I think just fortunate experiences along the way kind of brought me to where I am.
That's awesome. I feel like, that story of your dad and, obviously your mom being, a personal trainer herself, I think there's always a backstory as to why someone, dives into this field, because we talk about it every day with the younger coaches that we're bringing on. It is a true passion field, physical therapy, fitness. There's so much that you have to get through to become a professional in the field. And it is not it's not an easy job. It's a very difficult career path to take. And the people that last are the ones that really have it ingrained in them, from a very early age as to why they started. And, I think that shows in the way that you practice and, any of the higher end, performance physical therapists and, athletic trainers, massage therapists that I've worked with over the years, chiropractors included, they have some background, whether it's in sport or injuries or, their parents or family going through things like that. And, that's what keeps bringing good people through the door, of the field itself. And I think that, those are the types of people that move things forward, on the extremes.
Yeah, so, I couldn't agree more.
I didn't know about that story. That's an interesting story.
Yeah,
Dentist.
Yeah. It wasn't the typical, I got hurt as a kid and I went to PT and it was cool. It was never been, kind of looked into it, found it was awesome, stuck with it. And, speaking to your point on the why, it was actually ironic. A buddy of mine who's been in the industry for years and years texted me this morning and was like, hey, was just thinking about you and sending out positive energy, which I love. And that's why I surround myself with people like yourself, because of that good energy, promoting other people in the industry, seeing success. And he was just like, always remember your why, which from my perspective is you want to provide a better quality of care to your patients than you've ever been allowed to do. And that's truly what keeps me going, is just doing as much as I can from my perspective to help others achieve the goals that they want to achieve. It's
absolutely
really that simple.
And there's that old saying of no one cares how much you know until they know how much you care. I have a follow-up to that in that the way in this field that you show you care is to know. Meaning, you might come across a client that you don't necessarily know how to help just yet, which means you should be diving back into a book or a podcast or going to a seminar. And that's the great part about our field. It is so easy to get this information. Not always easy to find the right information, but at the end of the day, you do have to, a prerequisite is being a caring person and wanting to just help people. On top of that, you then have to become a voracious learner and reader, and that is truly, then your toolbox just gets bigger and bigger. You help more and more people. And like I said, as a client myself, I started, in my mind, I was like, wow, this guy really knows a lot, and when all the different disciplines that you use, we can kind of dive into, but it's definitely eye-opening when you work with somebody that is just kind of like part of the system, that they just go through the motions and they're just there. They might be a nice person and they're easy to get along with, but you could tell they're like just doing the same thing with every client. And I didn't get that sense at all, especially in the way that you approach it in the one-on-one, the one-to-one physical therapy versus the one-to-many, is another flaw, I think, in the system itself. But yeah, I mean, those are some of the things that, people don't always know the difference. They just see physical therapy, and they don't know, the difference between somebody that's really good and someone that is, just kind of going through the motions and using outdated technologies, outdated, information, from the 90s. So where do you see, and I guess where in your career, how have you seen physical therapy change over the last 5 to 10 years? And where, I guess, do we see it moving in the future?
Yeah. So I think speaking to your point in terms of like being a learner and being open with your patients, I think that's how you really create a relationship with someone is, having the ownership and the understanding and the ability to be humbled in the sense of, hey, maybe right now I don't have the best answer for you. I'm going to do everything I can in my power today, here, now to help you. But please just know that on the back end, I'm going to do everything that I can to deep dive into everything that it is from whatever resource it may be. And maybe that's not myself who can help you best, but I'm going to put you in front of someone that can help you best. Mm-hmm. And I think in a role where it's like you're kind of have like this client relationship and you want to be the hero and the savior and the guider, et cetera, however you may want to put it, I think sometimes it's better to have the understanding that maybe at times you aren't the best person for that individual right here, right now, and getting them to the person that can help them better, working in that collaborative approach and that team-based model is the best way that you can guide and help and quote unquote save them in the here and now. That's
I think
something
you see a lot of professionals out there kind of like demonizing doctors, demonizing the traditional medical field, which there might be some valid points that they're making, but there are really good doctors out there. There are really good surgeons out there. Yeah. And, I think you hear that a little bit too much where people want to be that savior. They want to be the be all end all. And, I think that is dangerous, especially because maybe they don't have that network. Maybe they don't have that network because all they do is say how bad doctors are and how bad surgeons are. But, when you find, and I guess that's a kind of a good question. How do you create those relationships as a physical therapist, and how do you find those people that are like-minded? Like, what is your, your filter for making those relationships?
Yeah, totally. I think that, I've been really fortunate to work alongside physicians over the years. First, starting at the Andrews Group in Alabama, I learned how to just create relationships amongst physicians. And then having worked with a large orthopedic group on the island, I was working next to physicians every day. And it's more than just like, hey, doc, like I've got this person, what should I do? It's like, no, like realistically, the surgeon does the surgery, they know what to do, and then they pass them along to therapy for the therapist to do what it is that they do. And transparently, a lot of these surgeons, they write the protocols and they understand from like a tissue healing and a surgical perspective, like what is the best approach and maybe what we should or shouldn't do. But transparently, they don't necessarily always know the rehab answers, nor do they want a therapist asking them rehab-based questions, much like I wouldn't ask them surgery questions. Right. I ask them, I think over the years, what I've tried to do best is, one, treat everyone like a human. A surgeon is a human. So when I was working alongside them, how do you create a relationship with anyone? Hey, doc, how was your weekend? How are the kids doing? How's the wife? How's the family? Like just normal human conversation, right, which forges a relationship. And then from there, I think I try to educate a lot of physical therapists who have trained under me in the sense of almost translate or speak their language to get the answer that you're looking for. So instead of, let's say it's an ACL or a shoulder or whatever it may be injury-wise, saying, hey, we're 10 weeks out, what can or can't we do? Hey, doc, can you fill me in again on what you did surgically so that I have a better understanding from like a tissue healing time frame, how that may or may not adapt my rehab process for this individual based on the protocol or guideline that we have from a standard perspective, right? And I think the flaw I see now is that too many people get caught up in these protocols. Instead of understanding that they're a blueprint or a guideline to follow that should then be adapted based on the individual and the specific surgery that occurred, they just go too hard at the bullet points that are on there and follow it to a T. And that's somewhat to a fault. Mm-hmm. So from like a relationship building perspective, how do I filter? Having worked with a bunch of surgeons alongside them over the years, figuring out the ones that truly get PT, truly care about where their clients go for physical therapy and understand the difference between good and bad rehab. And then the ones that also just don't blindly clear their athletes to return to sport because of a time frame. I've seen all too often over the years, it's like, let's use an ACL, for example. All right, 6 weeks, you're out of the brace. 12 weeks, you're going to start straight line running. And 6 to 9 months, you're somewhat cleared. And it's like the docs that I've filtered with, fortunately, trust me enough that, when a client comes in and asks them the question of, hey, doc, can I run? They respond back saying, what did Lewis say?
Right.
And, it's like, we kind of know to work together, and the docs then will call me even before their client is coming back in for a follow-up to say, hey, I've got so-and-so coming in. Can you fill me in on where they're at? That way, when they ask me these questions of what I can or cannot do, I have a better answer and we're in alignment. So I think it always reverts back to team-based approach, open communication, and a collaborative effort to, at the end of the day, help the client achieve the goal that they want to achieve.
Absolutely. And I think, those conversations are so important. I think that, a lot of the times, parents, we speak to parents a lot about, their kids' return to play protocol. But they'll say, well, the doctor said he should be out of the brace at this time. Well, the doctor said he should be able to sprint by this time. And that's on the day after the surgery or the week of the surgery. So, that sometimes we don't necessarily understand how the body heals. And the big issue that we have, especially in high school sports, is that they did not commit to the actual process of getting back so that we can clear them at each one of those stages. That saying that somebody's going to return to play in, let's just say, they're going to be out of the brace in 5 weeks. They should be able to, if they do physical therapy and strength training and keep up with things like nutrition and sleep. There's so many variables that can be thrown in, even if they do everything right. But most of the time, we find that they're trying to skip steps, or they're missing their appointments, or they're not using crutches when they should be using crutches. So therefore, their knee starts to swell before they're ready to go. And as an informed doctor and physical therapist, and a strength and conditioning coach, we have to have those conversations. And I think sometimes that is, we want our clients to return to play. We want our clients to return to the activities that they love doing as much as they do. But it's our responsibility to be that sounding board and protect them, not only against themselves, but against their coaches. We have that issue a lot too. When the coach hears, 12 weeks, all right, he's just going to start practicing 100% at 12 weeks. And there's that transition. So there's so many layers to physical therapy and rehabilitation and, return to play. What are some of the things that you've done that have kind of, ensured that your clients are getting the best and you're providing them, the right information at the right time, while also keeping it realistic and not feeling bad if there is a setback that you have to step in and maybe have that conversation with a coach or a strength coach or whatever it might be?
Yeah. So, I mean, to answer your question, I think there's always so many factors. This tournament is the most important, or this tryout is the most important, or there's always going to be something. So I think the overarching point is that time is just a number. However, objective criteria really determines when someone is going to return. We have studies that report indicating if you do this, your likelihood of injury is that. That should be the guiding factor, and it's not a guarantee. I mean, sports are sports. Injuries happen. Life happens.
Right.
But if you can just put in front of someone, hey, yes, there's a goal at the end. You need to show me or demonstrate that you can do X, Y, and Z. If you can do X, Y, and Z, we move to step 2. Step 2 requires X, Y, and Z. The first thing I purchased when I opened my practice was a whiteboard. Why? To educate, to empower, and to allow the individual to take control of their process. I am a guiding light. I do not do anything for the individual. So I never take credit for someone's outcome. All I do is tell you what to do. If you do what it is that I'm advising you to do, I could probably pretty much ensure that you'll get back to what it is that you want to do, but I'm not going to do that for you. I can't.
Right.
It's in
and
your hands.
We can't make promises based
Correct.
on, it has to be criteria based, right? Like this is the criteria. Once we get to this point, then we'll get to the next stage. And sometimes you might get to that stage and then have a setback. So, it is definitely, in the early stages of healing, the early stages of the rehabilitation process definitely takes a lot of patience, for sure.
For sure. And I mean, the amount of times that I've seen a follow-up where, maybe an individual was going to care elsewhere, or they were at another practice and insurance cut them off, and now they need to see me for a second opinion or in collaboration. And they're like, but I'm 5 months out and my doctor said I should be doing X, Y, and Z. I go, well, based on X, Y, and Z criteria, you're 3 weeks out in my mind. So I don't care about the time-based number. I care about what bucket of function you have that dictates what it is that you can do. So I think the biggest thing I look for is, what is the demand of the activity? What is the objective criteria that individual has? And how do we grab the lowest hanging fruit to just move towards the end goal that they want to achieve? Mm-hmm. And I think if you keep it that simple and you lay it out for the individual in front of them, when you're looking at something like a long-term rehab, be it maybe a surgery or an injury that does require patience, and you have to explain to someone that 9 to 12 months, it looks a lot smaller than it does when you break it up from the grand scheme of things. So I always try to work with the end goal in mind and then bring it backwards, which allows them to realize, okay, we're in the present here. This is what I can do as best as I can right here, right now. Maybe it's boring. Maybe it's not something I necessarily want to do, but it's laying the foundation for what it is that I need to do in order to achieve what it is that I want long term.
Definitely. And have you had any kind of, I'm sure you've had some stories in the past where things go wrong. What are some of the downsides to, that collaboration not working well, or, there is no trust in the system or no communication in the first place? Like, have you had any, I guess, to use maybe a more extreme way of saying it, a nightmare scenario that we've actually had a few ourselves as strength coaches where, we've trusted that the athlete would go back to practice limited, and then all of a sudden they're tearing their other ACL that they were rehabbing, the right ACL, and then the left tears, or they re-tear, because we gave them that set of criteria as to what they were able to participate in, and the coaches and sometimes even the parents did not use that caution, and they just went right for it. So do you have any stories, or you don't have to use names, obviously?
No, so I think more fortunately, I haven't had any like major re-injuries, and I knock on everything, hope to keep it that way. Mm-hmm. I think more of a nightmare scenario comes from the communication aspect, and I've seen it at all levels. And one case that I speak to is I was working with an ACL, and we were about 3 months out or 4 months out, and they were going back to college. And the parent had requested that I speak with the therapist that they were going to transition onto. And I called the therapist just as a courtesy, and I was like, hey, I've got so-and-so, they're this far out. And before I could even like move further, the guy's like, I've been doing this 25 years. He's fine. I know he's going to be fine. And I'm like, okay, I'm sure that from like a clinical perspective, you can handle this, but what about the human? Like, what about the kid that, like, do you want to know? I've been working with this person for 3 months. I know what ticks him off. I know what gets him going. I know what cues he responds best to. Like, you're treating a person, not an injury. So I think just clinicians and coaches have to really step back and remove the body part or injury part aspect of this and realize at the end of the day, you are treating a person, a human. And I think that's why I've fortunately had success in the athletic realm and gained trust from athletes across all levels, including the professional level, because they see that I always keep the individual's best interest at heart. I don't care. Not that I don't care. I do care about like the game scenario or the magnitude of the event. But at the end of the day, I care about the person first and foremost. Will they be safe? Will they be not only safe, but actually okay to compete? There's one thing in terms of like returning to play. There's another thing in terms of returning to the ability to play amongst your peers. So yeah, you might be ready to get back in there, but you might suck because you're not actually ready to compete compared to others. And, I don't want that to happen to any client. So I think just viewing them as a human, viewing their best interest at heart, that's how you build trust amongst people. And that's how you really get into like sports, athletics, and the ability to actually treat people who want to get better because they see that.
Absolutely. They might have, return to, the basic everyday, life type stuff. And then there's return to the actual high level optimized version that they were prior to the injury. And sometimes we even want to get them better because there's a reason why they got hurt in the first place. So conditioning them back into that, that competition is not only a physical, but it's also a mental thing as well. It's the confidence in their knee. It's the confidence in their, whatever, body part may have been injured. That confidence is really important because you're going to move differently if you don't trust that leg or that arm when you're moving. You're probably going to create some compensations. And that leads me to, another thought in the world of physical therapy of the holistic approach. And I think that you can speak more to, when parents, when I refer parents to you and to any physical therapist that I trust, the first question is, does he take my insurance? And tell me a little bit about the difference between I guess kind of like the guardrails that you may have if you were taking insurance, if you're dealing with somebody with an ACL tear, for instance, but you really understand that you need to work on their foot or their hip or, another aspect or, and you might even see that their other knee has some prerequisites that might get injured as well. What are some of the differences between the reimbursement route or the pay out of pocket route?
Yeah. And I think there's so many elements that go into that, in the sense of, when you let insurance dictate your health, you let someone without a health background determine your health, which is crazy to me. So, I mean, one of the best scenarios best examples per se was, I had an ACL injury, and from a tissue healing time frame, it takes minimum 12 weeks for that ACL tissue that has been taken from a tendon to turn into a ligament, at least 12 weeks to repair. I had an individual get cut off from therapy at 8. And I called the insurance company and I go, this goes beyond function. This goes towards now biology. Like, are you understanding that it's not even healed? And they're like, well, he can walk, he can use stairs, and it seems like they're not really in pain. Like, okay, but what happens to the fact that, like, the thing isn't healed?
Right.
You're just going to let them go on. And I tried to combat and be like, hey, they're at a pretty high risk of re-tear. Would you rather pay me as a therapist from an insurance perspective, the couple visits, or for another surgery when it inevitably happens because he's not healed? And that's the risk you run when you go the insurance route. I think the other thing now, what I've found is, I was in the insurance model for a long time, and it has its benefits. But at the end of the day, it unfortunately becomes somewhat of babysitting, where people are so reliant on 2 to 3 times a week for 6 to 8 weeks. And, I'll kind of go and I'll kind of do my stuff and I'll follow the flow and, I'll do the exercise and I'll hope that I get better. But now when an individual comes to me and they're, one, out of pocket, they're bought into their care. So they're actually going to do the homework that's given to them. And 2, they're given the time to, like you said, not just look at their knee. Maybe it's a foot thing that's contributing to their knee, or yesterday I had someone come in for a 2-hour session. Why? We wanted to spend an hour figuring out what the root cause of the problem was, and then an hour actually experimenting to see that it was. And sure enough, we got to the bottom of a 20-year problem. It was crazy. It was one of the best breakthroughs I've ever had with a client. And the ability to do that and spend the time one-on-one with someone just really is so game-changing. I mean, the results I get in one session, one-on-one with an hour, supersedes seeing someone in an insurance-based model for like 2 weeks. And truly that has become the case because, 1, you get to the root cause. 2, you address the root, not just the branches or the leaves of the problem. And 3, the individual is bought in to actually understand what needs to be done to get back, and then we'll do it.
Absolutely. That's a good analogy, the root versus the leaves. And do you ever have to kind of like, when you get on the phone with somebody that asks that question, what are the ways that you kind of explain the difference, and maybe what are some of the red flags that they might see in a traditional physical therapy model versus your model of the one-to-one approach?
So when someone asks me if I take their insurance, I usually tell them it's kind of a twofold response. I either say, 1, do you know what your benefits are? Which, to most surprise, no one knows.
It's too complex.
It's so
it's
complex.
Very confusing.
And they make it harder and harder and harder. And unfortunately, what I've been seeing over the years is deductibles are going up, copays are going up, reimbursements are going down. So then the second fold question is, my end goal is to help people. However, if my lights are off, I can't help people. So I tell them, would you show up to work if you don't know that you're getting paid? And they say, well, no, that doesn't make sense. And I go, well, would you show up to work if you were going to maybe get paid, but you don't know when and you don't know what? And then they also say, no. I go, good. That's why I need to see you one-on-one, and I don't need to allow the insurance to get involved in any capacity. My clients are allowed to bill out of network. They can submit for reimbursement on their own. We handle it from that regard. So it's not just cash. They can go via an insurance route. However, I just don't want someone who's not trained in health to determine the health of the individual that I'm working with. And And then I missed your second part.
I mean, yeah, I would say, what are some of the red flags that they might, of course, when someone's looking for physical therapy and they know that they're paying, that it's coming out of their paycheck, the health insurance, or they might be paying for health insurance, there's that they feel like they're losing because they're already paying for it in their mind. But what is the difference between the value, right, of going to someone like you versus going to, for lack of a better term, a PT mill that has one physical therapist and a few, understudies in a room full of people all doing the same exercises. They all have different injuries, but they're doing the same exercises. And friends, family members, myself included, have been to those places and get so frustrated and turned off. And then that just becomes physical therapy doesn't work. Yeah. Right. So what are some of the conversations that you're having with people with, the red flags to know whether they're going to a place like that? And I'm sure you're getting plenty of people that are frustrated with that.
Yeah.
But first time person that hasn't ever gone to a physical therapist, maybe just with the other considerations that they may have, what are some of those red flags that you might be pointing out?
And I think the largest misconception with physical therapy is that physical therapy is physical therapy. I mean, people spend weeks and weeks and weeks researching the right doctor or surgeon to see for their shoulder or their elbow or their knee. If someone was to come to me with, call it maybe, a neurologic condition or, a chronic neck or lower back thing, I'm going to be transparent and say, hey, I'm probably not your guy. I am a sports-oriented physical therapist that specializes in treating conditions of the shoulder, elbow, and knee. That is what I am most trained in. So if someone is going to come to me with X, Y, and Z, can I help them? Yeah, probably. Can I do a good job? Yeah, because I have the time to see them and do that? Sure. But I'm going to be transparent in the sense of saying, hey, you got to go see X, Y, and Z. But too many people just think that PT is PT, and it's not. So in terms of red flaggy things, what I saw in the insurance model, unfortunately, is what I call the PT flow, the unfortunate flow where you walk in, you're put on heat or stim, and that's mainly so that the therapist can kill time and finish up working with the client who's there before you. Maybe you're put on a bike so that they can document some notes and catch up with you and see how you're doing so that they can just get out of there at the end of the day as soon as possible, or they're doing a little hands-on during that time as well. You then are passed along to an aide, an understudy, an assistant who's, maybe training to go to PT school, but they're not the movement optimization specialist. They are an undertrained person who's not really even supposed to take you through your exercises, but they do. Mm-hmm. Why? Because there's just so many people in the room, and then your exercise is not progressing. If you're not loading and you're not being challenged and you're not in an environment that's promoting positivity, or just promoting you to actually get better and progress and achieve your goals, then that's a huge, huge, huge red flag to me. And I think what I learned from my fellowship, which was the best experience ever, was, and I think people don't want to go to PT. Most of the time you're injured. It's more of a burnout. It's more of a burdensome. It's annoying. It's not fun. You're most likely in pain. And the difference that I saw during my fellowship was the complete opposite. People were mad when they weren't able to get an appointment. Mm-hmm. Why? Because they wanted to get better. They were in a room full of other athletes and full of other motivated individuals who were excited to show up and actually work towards getting back to what it is that they were doing. There was camaraderie amongst the room. There was positivity in the room. There was energy where, people were jib-jabbing back and forth oh, you can't do that exercise. I could do that exercise. Or It had a locker room feel to it, or this athlete feel to it where, there was a competitive spirit that was pushing people towards that positive aspect. So I think the biggest red flag is if it's not motivating, it's not positive, and your therapist isn't open and honest with you about having the experience to treat the condition that you're specifically in for. Major red flag to me. Yeah, I mean, I think that flow sounds very familiar, to many, many clinics out there that, you're essentially, like you said, you're kind of wasting time or filling time, mainly because the PT, it can't handle more than, the people that are in the room. But yeah, it kind of also, reminds me of the downside and the frustrating part about, essentially just moving, right? Somebody that is moving with pain is going to avoid that range of motion, avoid that pain. So what happens? They become sedentary. Then when you become sedentary, what happens?
You become unhealthy. You start putting on weight. You start putting on weight, then what happens? You become depressed. You become depressed, then what happens? You stop moving altogether. And, you can look at the timeline of someone's life of the day that they had some sort of an injury to the day that they, essentially pass away from inactivity, and especially later in life. We're dealing, most of our customers, most of our clients now are over the age of 40, some over the age of 60, 70, wow. And they're still working out because they understand the value of challenging their bodies. Mm-hmm. But there are so many people out there that are dealing with some sort of a pain, whether it's neurological or physical. And what's sad about it is that they may have gone to one of these places and they may have said, oh, I tried that, mm-hmm. right? So, I guess speak a little bit to that, kind of like the snowball effect of that one injury, yeah. And then the mismanagement of that one injury. Obviously, athletes deal with it every day as well. Mm-hmm. And then that spirals, they spiral mentally because that's their identity, yeah. Right? They identify with the sport, with being that athlete. I dealt with it myself, not really rehabbing my shoulder correctly, never getting back on the field as a college athlete. And that was a really tough thing to deal with. Mm-hmm. I dealt with a lot of weight issues and health issues over the years because of that. Mm-hmm. So I guess stress a little bit about the importance of, when you start to notice yourself slow down,
yeah.
What do they need to do?
Yeah. And I think that was a huge contributor to the name of my practice, which is longevity, PT, and performance. What can I do now so that I can then continue to do what it is that I want to do later in life? I mean, it's unbelievable that you have clients above the age of 40 as your primary population, even mm-hmm. like you say, 60, 70, 80, that is amazing. That's the best thing that you can do for yourself. And then speaking to your point, my biggest goal always and always will be help the individual achieve the goal that they want to achieve. How do I do that? Give them as much as what they can do while they're in an injury-ridden state to feel like they are performing. I say first and foremost that the difference between traditional PT and sports PT is performing with respect to injury. So if someone comes to me with a bad ankle sprain and they're in the boot, why is it that we can't do upper body exercise? Why is it that we can't do cardiac conditioning to maintain, cardiovascular health? There's so much that can be involved keeping an athlete engaged. It's so easy to just be like, I'm injured, I need to rest, I need this thing to just heal on its own, and I'm just going to stay out and it'll get better. And that is the complete opposite of what should be done.
It's dangerous.
Yes.
Because it can lead to so many other issues.
Yes.
Yeah.
And mainly that psychological point that you speak on. My goal is to get people back with a team, which is why, like I said, that red flag is if you're not in an environment that's positive and motivating and surrounded by others that are keeping you engaged, then you're going to not only lose the athlete due to injury, but you're going to lose the athlete due to the mental side of things, which is a scarier way to lose them than it is the physical aspect as well. The physical aspect is quote unquote easy in my opinion. It's the mental aspect, the confidence, the willingness to return is the bigger side of things, which is why I think it's so important to have good strength coaches that you can lean on and be in a collaborative effort where it's like, hey, yeah, we've got this injury, but here's how you can continue to train and continue to stay healthy. That way, when you get back, we're not fighting other things that you need to do to return to sport. It's just the one little thing that you had going on, which is, in my opinion, most of the time, not a big deal.
Right. We've had so many times where we do get frustrated with doctors and physical therapists that, a client injures their ankle or their foot or their knee. And, in my experience, in sports medicine, you've got 3 other limbs and there are ways to adjust the program and there are ways to, protect that limb that's still, not functioning at 100%. But there's no reason why we can't push the opposite leg. We can't push your upper body. We can't still condition you in ways, and as long as we're communicating on the safety, on what's allowed in the gym, as long as that line of communication is open and the trust is there, mm-hmm. I think that's one of the biggest things is the trust factor. Mm-hmm. The doctor and the physical therapist that doesn't necessarily trust the trainer mm-hmm. will not allow them to go and go back to working out. Now that's more of, a disservice to the client themselves because just because they want to be as safe as possible, doesn't mean that that person shouldn't be staying active in any way possible. And there obviously will be some times where the activity will go down. But just from my experience, what we've seen, weeks turn into months, turn into years, where people get out of that routine. They get kicked out of that routine. And I think that's the great thing on our collaboration on how we've worked together, is that you understand the severity and importance of keeping not only an athlete, but someone that's, in their 50s or 60s, keeping them moving throughout the process because of all of those things that we talked about, the mental side, the physical side, and just like, the development side. Even if you are an athlete and you might have an injury that is something that is really, really difficult to come back from, right? We've dealt with athletes that essentially have had career-ending injuries, whether it re-injure, tearing an ACL, re-tearing the same, and then tearing the other. We've had some stories and some really sad situations, but those people still have lives to live. Yeah. Just because they were playing at a high level in college doesn't mean that they're not going to be physical in their life, right? And those people that are kind of turned off to the process in college, they wind up having way more issues later in life because they were essentially forgotten or they fell through the cracks of the system. So, I think that that's one of the things that we're really, happy with working with you, and also just we're on the same page with, we want people to live their best life. We want them to be the best version of themselves, and that might not be on the field anymore. And there's a lot of former athletes, myself included, that are in our adult program that want to get back on that field, but they also understand like maybe that's not the level of athleticism they necessarily need in their life. Maybe one day they will get back to that, but they need to be able to pick up their kids and run around and, and play and, show their kids how to play with a lacrosse stick and things that they did earlier in life that because they've had so many injuries and they've kind of neglected them, they allow those things to stop. Yeah. And I think that, that as a physical therapist and someone that is on the performance end of the spectrum, it's something that, it exudes in the way that you treat, and it also really influences how people understand the whole process, right? Because you said before, like they just look at, they're checking a box of, I'm going to physical therapy and it's all the same, but it's not. It really isn't.
No, and I can't speak highly enough to you yourself, your team, and just everyone in your facility who's so open to collaborating and open to learning. I say it all the time, like you gain experience from every single other person, and I think. A lot of PTs now, they come out high and mighty with this doctoral degree and they just assume like, okay, I know best. And it's like, dude, you've been training for clients for 20 years.
Right.
I've learned so much from like your aspect of strength and conditioning that's helped me adapt my approach over time. And it helps us understand not only that, but like if I'm treating a client who trains with you, what is it that you're going to do with them that I need them to do? Because that's eventually what they're going to get back to.
There's a lot of crossover.
So much, so much. And it's, like I said, PT is training with respect to injury. Learn from trainers because they're the ones doing it. They've been doing it for years and they're getting good outcomes. And if you can especially find a trainer that's open to vice versa, having that communication with allowing the client to progress with respect to their injury, home freaking run, home run.
And I'll attest to our staff and, communicating with you.
Yeah.
Coach Hannah, Coach John, Coach Brandon, they've been getting calls, text messages from you like, hey, this is a new client that's coming in. This is what I've been dealing with in physical therapy. These are the types of injuries that he or she is working with, and these are the types of things that I want to stay away from. These are the types of things that they should be working toward. And they come to me like, Dr. Lewis gave me a call and he filled me in on everything. I was like, isn't that amazing? Isn't that awesome? and it wasn't just an assumed understanding or just no, don't go back to training. It was, this is how, and this is how I will also, that's how collaboration works. It's communication, right? Yes. And it's, you taking time out of your busy day to give that coach a call or send a text message with, kind of like a download report of what you're dealing with, what you're seeing, and what we should be able to work on. And, again, that's invaluable because there are a lot of people out there that are frustrated with where they're at. They're frustrated with they're in physical therapy, but then they're, like you said, they're timing out or they're kind of not sure of what to do. And most people would benefit from joining a strength and conditioning program. Yeah. And, and the big thing for us is we know that life happens. Even people that have been with us for years get injured. It happens. It happens outside of the gym. It happens sometimes inside of the gym. We do our best to not let that happen, but it does happen. And, you could have slept wrong. You could have slipped on ice like we have outside today. And, those are the little things that, as long as we can be there, because stopping is the worst thing that they can do. And the continuation, it's only done with this type of an understanding and collaboration and relationship that, with us, our network is so important. If we don't have the right people in our network, like you have with your doctors, and, I trust that anybody that you put in front of our clients, whether it's, someone that you might refer them to, we just trust that you're going to be putting them in the right hands as well, which is a great way to have that, that network grow.
Yeah. And I appreciate that. And I think what's been so nice about working with your staff and your team is one, you guys are on an app-based system, which the client can then come to me and show me their program. And I could be like, cool, you're doing this, this, and this based on what you're dealing with. Why don't we adapt so that you can continue to keep up with the class, continue to remain in that engaging and positive environment so that you don't lose the mental side of things or your identity, but here's how we're going to modify so that you can do more of what it is that you want to do. It's not about just pulling entirely when something happens. Injuries happen.
Right. Life
happens. It's a matter of what more can we do to continue to allow you to do what it is that you want to do. And I'll speak to this. I was working with an ACL individual last year as a sophomore in high school, never been injured and never was on a workout program. And this kid trained like an animal. An absolute animal. For a 15-year-old, was bought in from day one, did everything the right way, passed every single test, progressed the right way on the field, from non-contact to mild contact. Coaches were like all on board. And what happened? Life. In one of his first practices, his own teammate accidentally ran into him and his knee blew out again. It happens. Right. And you know what? He trained so hard that he actually played his whole season without an ACL and didn't have a subsequent injury on top of that. He recently got it revised and is like, I'm looking at him like we spoke about time frame. He's 3 weeks out of surgery. And I'm like, dude, you're at like the 8-week, 9-week marker based on what you're achieving. I'm blown away. And I think if you really set your mind to it, you can really achieve so much more than what you thought was capable. I mean, me and the physician who were on the case were like scared out of our minds when he was going back to playing without his ACL. And you know what? He actually had a pretty good season. It was crazy.
That's awesome. That's amazing. Yeah, and it takes a different type of person.
Oh yeah,
and that I'm sure that athlete had a strong head on his shoulders and mindset, and obviously maybe was fearful, but you guys were in his corner, and that's amazing. And I've heard a few stories like that, not many, but
yeah. And I'm not promoting that people necessarily do that, but it's possible.
No, that's awesome. But Louis, thank you so much for taking time out of your busy day. I know that you're, I see you wall to wall of, every day in your clinic over in Garden City. Longevity physical therapy. What are some ways that they can get a hold of you, follow? And get in touch.
Yeah, so it's either on Instagram, Longevity PT Performance, or Lewis_Lupowitz_DPT. You could reach out to us via our website, phone. Happy to get in touch. Just really looking to help motivated individuals stay healthy, stay active, stay athletic, not just for the now, but for the long haul of life.
Absolutely. Thank you, Louis, and thank you, everyone, for listening and watching. Please give us a like, a share, subscribe, all that stuff, and we will be back again soon with another episode. But thanks so much, Louis.
Pleasure.
This was great.
Yeah.